Periocular and orbital lymphangiomas can be a very difficult condition to treat. So typically this is how we see what the lesions that we now call as lymphangiomas, which are seen in children, younger patients who've recovered from, say, an episode of cold, or during an episode of URTI, they develop sudden onset proptosis. Now this is a very discrete, well-defined anterior located lesion, which we would call a macrocystic type of variant of a lymphangioma. And these are very, very amenable to a transcutaneous therapy because they are directly right there. But they can also be the diffuse variant, where you see diffuse orbital involvement, intraconal with extraconal, which is basically transconal, and with lid involvement as well. And in these cases, we use bleomycin, where we are able to aspirate and sclerose it. It's mixed with lidocaine and xylocaine and sterile water in a 1:1 concentration, and is injected. These are just rough guidelines where we inject about 20% of the aspirate that is obtained. Now this is the same child. Because it's an anteriorly located lesion, we are doing a percutaneous treatment where we go in directly. Here we are using a butterfly cannula and we are aspirating it. You can gently move the tip around to all corners of the large cyst to make sure that everything is aspirated. And once that is done, then you inject the bleomycin back in it, and then you can patch the eye. This can also be done with ultrasound. This is courtesy Dr. Bipasha Mukherjee, where you can see under ultrasound guidance, you localize to make sure that the tip of the needle is within the cystic cavity, aspirate it, and then inject the bleomycin, keeping the needle still within the cavity center, and confirm that the location of the tip of the needle is in the large macrocystic lymphangioma through ultrasound. You can see very good results that we obtain through this. This is again one session of sclerotherapy. So to summarize, bleomycin sclerotherapy should be the first line of treatment for all venolymphatic malformations like lymphangioma.